Welcome back to another day in the classroom. We are looking at anatomy and physiology within the exercise science curriculum. And today we are going to be taking a closer look at the posterior thigh. Muscles of the posterior thigh include the hamstrings, which is a group of muscles that include the semimembranosus, the semitendinosus, and the biceps femoris. Also within the posterior thigh are the gluteus maximus, the gluteus medius, and the iliotibial tract, or commonly referred to as the iliotibial band. You will see both. And these muscles play a significant role in extension of the hip and flexion of the knee. Alright, starting with the hamstrings, which I said is a group of three muscles, the semimembranosus, semitendinosus, and biceps femoris. First off, I'd like to mention where the term hamstrings comes from. It originated from a practice that used to exist within slaughterhouses. Pigs that were up for slaughter, before they were processed, needed to be bled, which means they needed to drain the blood out of them. And what they would do is hang these pigs by the muscles on the back of their legs. They would string up the ham by using this group of muscles, hence the name, the hamstrings. First muscle in the hamstring group is the semimembranosus. And as you can see on the diagram, the semimembranosus has its origin point on the ischial tuberosity of the pelvic girdle, and it has its insertion all the way down on the medial epicondyle of the tibia, and that's the posterior portion of the tibia. The semitendinosus is a very similar shaped muscle. It has its origin point again on the ischial tuberosity, and it has its insertion on the medial superior tibial shaft, right down in this area here. The biceps femoris is the third muscle within the hamstring group, and like the biceps you find in the arm, the biceps brachii, this biceps has two heads. The short head having its origin on the posterior inferior aspect of the femur, and its insertion down on the head of the fibula. And the long head has its origin point on the ischial tuberosity again, and it has its insertion again the same as the short head on the fibula, the head of the fibula to be specific. The gluteus maximus has its origin down the iliac crest, across the sacrum, and all the way down into the coccygeal region of the spinal column, and it has its insertion point actually right along here in this region, where it inserts onto the iliotibial tract or the iliotibial band. Next we have the gluteus medius, and you see here it has its origin all the way along the iliac crest, and you can see clearly on the diagram that it has its insertion point on the greater trochanter of the femur. And finally we have the iliotibial tract or the iliotibial band, and it is a large expanse of connective tissue that runs all the way down the lateral portion of the leg, and this acts to maintain the integrity of all the musculature within the leg, and it also gives rise to insertion points for muscles along the side and posterior of the leg. Actions that occur from this muscle group: extension of the hip, which involves extending the hip backwards in this position, and the gluteus maximus is the primary hip extensor, and the primary knee flexors are the hamstring muscles, which contract in this area and pull the lower leg back, decreasing the angle at the knee. So all of the muscles included in the hamstring group, which is the semimembranosus, the semitendinosus, and the biceps femoris, are all very important knee flexors. Alright, quickly to review. Page 62, take a look. Diagrams you have to color are indicated here, and here, and here, and here. And quickly to review those muscles, you're looking at the hamstrings, which are made up of the semimembranosus and semitendinosus, and the biceps femoris, and also the gluteus maximus, gluteus medius, and iliotibial tract or iliotibial band, and the roles those muscles play in extension of the hip and flexion of the knee. Good luck. Make sure you review those in the coloring book, and you can write the test when you're ready. Have a good day.